Dr. David Odhiambo, you are here. Thank you as you come on stage. Odhiambo is the Executive Director, Africa Pharmaceutical Network. He doubles up as a Senior Advocacy and Public Policy Lead for the Federation of Kenya Pharmaceutical Manufacturers and the Adjunct Faculty at the United States International University. He's the Chairperson of the Supply Chain Committee of the Kenya Health Care Federation. He has so many accolades. We may take a whole day reading it. He holds an MBA from Said Business School, University of Oxford, Bachelor of Pharmacy from JKUAT, a postgraduate certificate in project management, combining very well pharmacy, business, and project management. Put your hands together for Dr. Odhiambo. Karibu sana, Daktari. So now we are going to the Federation of Kenya Pharmaceutical Manufacturers. Dr. Odhiambo, this is yours. What will it take for Kenya to develop and manufacture more of the medicines, diagnostics, and other health products we need locally? And many Kenyans here, they buy Kenya, build Kenya, very nice slogan. But the biggest concern is the price of medicines, and believe that imported medicines are of better quality than the locally manufactured ones. How will manufacturing more medicines here in Kenya make treatment more affordable for the mwananchi? And what assurances can you give on the quality and safety of the locally manufactured medicines?
Thank you so much. It's good to have this conversation, and I look at it from first key piece is what would it take to get Kenya to manufacture most of the medicines that we need as a country, but as we need as people within this ecosystem. One of the key things that I would say from the Ministry of Health, you see there's a diagnostic report that looked at the capacity. Currently, we talk about 30%, but when you look at it in terms of the essential medical products and technologies that are being used in the country, our local manufacturers produce, I would say, up to 40% of them, which means there's already substantial number of those products that are being produced. The question would be, do we still complement them with imports? Definitely there is. And how do we then move from the current 30% in statistical value, but over 40% in terms of actual items and products that are being manufactured? This comes from first understanding, where does that ecosystem lie? For people to produce more products, we need investments, and those investments must be able to actually harness the returns that they expect. When the cost of production is as high as it can be, that becomes a problem. And most of it comes from a tax policy perspective. And I think we need an enabling policy environment. And my example would come from most recent and the most current challenge that actually the industry is currently contending with is the Finance Act 2026 that was passed. And from the Finance Act, pharmaceutical products, raw materials, inputs, and packaging were reclassified from zero rated to exempt. That process took 1.5 months to be approved from Ministry of Health and the National Treasury. But now operationally, the nuances are still coming in where, how do we then get it to be applied for the exemptions? Every single consignment, that becomes an operational nightmare. So I think policy inconsistency, but also the implementation operational hurdles that need to be addressed from an impact standpoint, that is an opportunity to unlock value. The other piece is the ongoing engagement, and I would say from the Directorate of Health Products and Technology, there's been a lot of engagements with industry and trying to see how do we ensure that we move from where we are to the next frontier. And I would say it's a matter of now asking ourselves, there are policies in place. We have the health products local manufacturing strategy that was rolled out. How do we make it work for the industry to actually enable them to produce more? That would be key. The local industry have gone to the level of having these, I would say, technology transfer agreements and partnerships. And I know Wesley is talking about it from BioVax, whatever they're doing. These collaborative engagements is going to ensure that we're able to produce more advanced technologies, more advanced products, but it is by facilitating those partnerships that we're able to move to the next level. The third thing, if you're producing a product and nobody's buying it, nobody's using it, there's no need to produce it. How do we guarantee our local manufacturers have a sustainable and a reliable market in the country? The government is the highest and the greatest purchaser of health products and technologies, and it is a government mandate to guarantee every Kenyan has access to safe, effective, and quality health products, but also access to healthcare generally. That means if our greatest purchase of health products is the government through KEMSA, how do we make KEMSA buy more from local manufacturers, and beyond buying, being able to pay for those products so that we have an enabling ecosystem that is actually complementary and supportive? Those are key things that we need to be able to guarantee. At the moment, there are still lapses, and we're hoping that we can make the best move as we move to the next frontier. When we go to the other piece, the other question was that consumption, and I would link it to actually my last point is Kenyans would be asking access, affordability, and quality. And that is a critical conversation that every Kenyan has to have. But when we look at it in terms of access, what comes into the cost of products is the cost of raw materials, cost of manufacturing, and the cost of logistics. When we're manufacturing them locally, I don't have to ship it from India, which means that cost is already reduced in most of cases. So that is a cost that we can offset. But the question is, can I produce at scale to be able to compete with an Indian or a Chinese manufacturer that is supplying 196 countries all over the world? So that becomes our competitive advantage. And I would say locally manufactured, we have that de-risking capability, but also an access when you have disruption that what we had with COVID-19. Now we can be guaranteed that all our 36 local manufacturers are able to supply what we need at that moment when nobody else is selling. That could be an opportunity for us. And I would look at that as an enabler of access, but also the cost reduction that we come in when we have an enabling ecosystem where the tax policies are favorable, the cost of production is lower, we're able to produce it. The last piece in quality, and this is a conversation that I would say from my engagement and work within the industry, most of our local manufacturers meet the highest standards of quality standard because some of them are already WHO pre-qualified. Some of them are being audited. Some of them have made the certifications in terms of the EUCE. For example, Revital, where you talked about Universal, TASA is under WHO pre-qualification. So they already meet the standards. Beyond that, we have our regulator here. With advances in regulatory oversight, there are improvements in good manufacturing practice standards, which is a compliance requirement to guarantee that whatever is leaving my company today is of the highest possible quality and is worthy of human consumption. The question is, are we communicating this enough to the public? Because when the people don't know about it, there's no way they can trust what is coming into them. And that is the opportunity that we have as an industry to communicate the investment, to communicate the value that we're bringing in, but also to communicate quality measures and what the regulatory oversight mechanisms are in place. Because if we're able to do that and demonstrate it continuously, we build confidence, consumers are taking our products, the government will be buying more of it, and that is the next frontier of where we're moving it. And I'm sure the regulator will talk about some of the other advances, but the key is quality is paramount, access is an enabler, and affordability becomes the last piece where we guarantee that everybody of the 55 million Kenyans can have the products they need. Thank you.
Thank you very much, Daktari. Well put. So we need to make all sides of the coin workable. The access, the government should protect in terms of buying. You may make and then you don't have the buyers. So thank you very much.